I'm being joined by Dr. Jay Kooch. Did I say that right?
Yep, you got it.
He is a PM&R physician.
I went to the Rehab Institute of Chicago for all of my training, and I came out and practiced interventional spine care for 12 years in Pennsylvania. Graduated to more of the business aspect of things, eventually left clinical practice about 5 years ago, and now I'm in healthcare consulting.
Tell us a little bit, and we did talk offline for a while, and so I know what Jay's story is, but tell us a little bit about what you're doing where it comes to social media and maybe
Sure.
how you got there.
Well, I got a little bit of a new project because now that I'm in the business side of things, now I'm missing kind of helping out the patients. So I've seen that there's this really large need, and I remember going back in my practice and coming out of medical school, and everything was evidence-based. Well, patients came more and more with these alternative questions, alternative medicine questions. What else could I do from nutrition, from exercise, anything like that to help out their condition besides what I was offering them? So this idea that I have now from a social media standpoint is to appeal to that, because I see that there's this huge disconnect. The way we're taught with traditional evidence-based medicine and all these alternatives that are out there on social media. And I'd like to try and bridge that gap and have a non-controversial way, and I've chosen the podcast to be able to have people on both ends of the spectrum to be able to discuss things that are very important.
Okay, so you're applying your degree. I know you've got a osteopathy degree. You're applying that to the need that you're seeing for the people that sort of aren't being satisfied by the traditional ways of giving out medical care, correct?
Yeah, it's not only dissatisfaction, but it's also just questions. In my particular view, and I don't want to always push my view, but the idea is that why wouldn't you use every tool in the shed? So if a patient came to see me for a spine-related condition, I wouldn't just implant a spinal cord stimulator or do an epidural steroid injection. I would try and teach them about having a nutritional program that may be anti-inflammatory, in addition to get them into a biomechanical functional exercise program.
Yeah.
In addition, what I've seen obviously is from a mental health standpoint, if the patients aren't buying into what you are quote unquote selling, meaning your plan, then they're not really going to have the best success. Right. So if you bring all of these tenets together, you can have the best success.
Oh, I actually really like that. And I know various physicians on the SoMeDocs platforms that are seeking to do that just because of the constraints of healthcare today, and the fact, even just the simple fact that we've got so little time when we work for a big organization to actually see the patient. And so maybe you're addressing some of the things that are maybe have been pushed to the wayside. And it's so nice to see physicians dedicating their time and effort to doing this. So let me tell the audience also just some background from a SoMeDocs perspective is that I'm Donna Coriel. I'm the founder of SoMeDocs, and Jay and I connected through social media avenues. And that's the power of social media, is that you can connect with someone who's doing similar work to you, in the same way that when we create this content piece, this video, we're looking to help Jay to not only start out his podcast, but maybe even find collaborators, like physicians out there who feel like what he's doing sounds kind of cool and maybe want to reach out to him and connect with him to sort of push this forward. So that's right. So that's the beauty of something like SoMeDocs. And I'm happy that we can hopefully help you to expand the podcast idea. So really quickly, just what's going to be the name of the podcast and when do you think it's going to be launched?
So the podcast is called Reach a Place Called Success with Dr. J. My social media Instagram handle is Dr. J Kooch.
Okay.
And I just launched that this Sunday, yesterday.
Right.
And this Thursday and every other Thursday will be a launch of the podcast. So this Thursday is actually the teaser for next Thursday's podcast, which will be my own. And then the second podcast, which would be 2 weeks later, is Dr. Scott Stoll, co-founder of the Plantrition Project. He also was an interventional spine guy, worked with me, and he's into nutrition now, 100%. So he's super excited to be on. We've already recorded everything. Everything's in editing now. And
Right.
we're always looking for physicians to be able to come on with their expertise,
Right.
but then also just be part of our, community.
That's wonderful. I actually just right off the top of my head, I'm thinking of Dr. Lynn Stiff, who is also forming a social media account surrounding her. She used to be a dietitian, and now she is a physician who wants to bring back the power of diet. Giving her a shout out, but hopefully I'll be able to connect you with more doctors just having done this video. Thanks so much for hopping on.
Thank you. Appreciate it.